Hey, good morning, everyone. Just doing an audio check. Can folks hear me?
Yes.
Yeah.
Okay, great start. I hope everyone's having a good day. Uh, this this meeting is meeting number two. So if anyone was here earlier, you will probably see some repeats. But thanks for being here and welcome. So I think we're starting with roll call.
Good morning, and that would be my cue to start the roll call. Good morning, everybody. My name is Chicky Flowers. My pronouns are she, her, hers, and Shakanya. I am the director of the Oregon Health Insurance Marketplace. And let's do a quick roll call of members of the Health Insurance Marketplace Advisory Committee. If you are on, can you please come off mute and indicate that you are on? Gladys Batwell, Stacy Carmichael, Charles Fisher,
I'm here on video.
thank you, Ron Gallinat, Paul Harmon, Chair Lindsay Hopper,
Good morning. My video.
Shannon Lee,
Present via Zoom.
thank you, Kathleen Orrick,
Present via Zoom.
Claire Pierce-Roble, Om Sakinai,
Here on video.
Vice Chair Nashoba,
Present.
Joanne Sumbrennan.
Present on video.
Okay, thank you. We officially have quorum to conduct business. We have 7 HIMAC members on. So thank you, everybody, for being able to join meeting number 2 regarding the marketplace assessment rate for 2026. Back to you, Lindsay.
Thanks, Chicky, and thanks everyone for being here. This is familiar information to many of you, but it's really important. We just wanted to share that we're committed to a safe and inclusive meeting for everyone attending, and that we have different perspectives, and that's the point of how we're brought together. So there's no bad questions, silly ideas. Please raise your virtual hand or put it in the chat or wave your arms, and we will probably see you. And please be on camera as you're able. Thank you. Next slide, please. Okay, if there are, and I'm looking at the list, if there are members of the public, please hold until public comment sessions and we will queue you. Of course, if anything you experience makes you want to reach out or something unacceptable occurs, please connect with Chicky, who you just heard from. And I certainly would want to hear from you. Next slide, please. And then when we do a roll call, please state your vote when your name is called and Chicky will call the roll. Thank you. Victor, I think we're headed over to you.
Good morning. Hi, everyone. Victor Garcia, he, him pronouns, operations advisor and program liaison for the marketplace. And just going to go over very quickly what the marketplace assessment is. It's the mechanism that funds all of the marketplace operations, so we don't use any general funds, but we are funded by an assessment on insurance companies that offer the insurance plans sold through the marketplace, which are known as qualified health plans or QHP. And that assessment and standalone dental plans, which we didn't update the slide, but SADP for short, and those have separate rates. Those rates are set by Oregon administrative rule, and we look at those annually. We haven't really adjusted the rates or made them different in a number of years, so this is the first year we're really looking at an increase ever since the marketplace started in 2015. Currently, insurers pay a separate assessment for marketplace and marketplace operations. Those are the education enrollment activities we do in the state. And then another assessment to the federal marketplace, healthcare.gov. And that is for the platform that people use to enroll. So we currently don't have control over that. That is separate and at the federal level, and part of why we're undergoing the SBM project right now to bring that control to the marketplace. Next slide. So when we set the assessment rates, we use a per member per month, also known as PMPM structure. So that's for each of the plans on the marketplace, there's a set amount that each plan is kind of assessed, and that's right now at $5.50 for medical plans and 36 cents for dental, and that's what we're looking at changing this year for the coming plan year. Most other states assess actually as a percent of the premium that people pay for the plans that they have. From the beginning, the marketplace sort of decided that rather than having that kind of track with medical inflation and medical costs going up the way insurance premiums do, that it would be better to have that sort of track a little closer to what our projections are based on enrollment and kind of have that, I guess, a little less uncertain with a little less risk of just kind of collecting a big pool of money and tracking a little closer to our actual expenses. There are separate rates for medical and standalone dental cares, as I mentioned. We do review those annually through this process. We have an economist review our previous year's enrollment and then create sort of projections for enrollment based on historical data going back a few years. And then we update the rates once we reach a decision and get input from the public, from the advisory committee by amending administrative rules. 945-030-0030 for those interested in looking that up. And then our statutes require that the rates be reviewed by this committee before filing the assessment rule, which is why we wanted to make sure we capture, the votes from as many members as possible and gather that input to make sure we're not missing anything, especially for this year. This year is especially important because we are looking at an increase. And again, that's sort of out of the ordinary, but very necessary given current landscape and also where we're headed with the project. So Caleb will be getting into that in a little bit. So that's just some background. Any questions on just process or procedure? We'll be talking a little later on next steps and rulemaking and that sort of thing, but upfront, any questions on that? Okay, thanks. And I will hand it off to Caleb.
Thanks, Victor. My name is Caleb Levon. I'm an economist, senior manager at CBIZ Optimus. I'll be talking about the assessment rate history, which Victor just shared, the expenditure, some of the assumptions that go into the forecast for enrollment. Then we'll look at the enrollment and premium projections. We'll discuss the rates that would be necessary to cover the expenditures given the forecast and do some revenue estimates. I'll sum it up, all the various pieces, and then at the end we'll talk about the fund balance. So a relatively quick discussion of those items. I'll try to move through them expeditiously. Okay, next. As Victor mentioned, the rate has been $5.50 since before the pandemic for the medical. The standalone dental is 36 cents per member per month. And we're talking about the calendar year for 2026. Remember, the marketplace operates on a calendar year, not a fiscal year. That can be confusing when looking at the budgets and the fund balances, but we're discussing calendar years, and we're talking about the rate for calendar year 2026. Next. I'll cut right to the chase, let you know where we're going, and then we'll talk about how we get there. We are recommending an increase in the medical assessment rate to $6.85. Remember, it's currently at $5.50. And that the dental assessment, the standalone dental assessment rate, go up from 36 cents to 45 cents per member per month. Now, the reason that we are asking or recommending this increase is because the enrollment is forecasted to go down for a couple of reasons that I'll discuss in a moment. And the expenses are projected to increase in calendar year 26. So with enrollment going down, and expenses going up, the assessment rate needs to increase in order to cover those expenses. There are reserves, that's the fund balance that I mentioned. We don't recommend spending those reserves down during 2026 because of the high degree of uncertainty in the marketplace environment. So keeping those reserves will mitigate risk, in addition to providing some additional investment income, but mostly it will help buffer the marketplace if there are some unexpected changes, if the enrollment doesn't come in at the expected levels. Next. So the starting point is the expenditures, and that is the costs that need to be covered by the assessment. And the marketplace expenditures here shown in calendar years again have increased moderately over time, and are projected to be a little over 10 million in 2026. And that includes both their expenditures and also the shared services costs that they incur as well. So that number at the bottom right, 10,088,000, that is the amount that the assessment needs to cover in order to stay neutral, budget neutral. So that's the number we're aiming for. So how do we get there? Next slide. We get there by multiplying the forecasted enrollment times the assessment rate. So the first step in that process then is to forecast the effectuated medical plan enrollment, the number of people enrolled in the medical plan. There's also obviously a dental portion and some investment income, but we'll start with the medical plan. So we create a baseline forecast using the recent history, and I'll show you a graph in a moment of that recent history. And then to that baseline forecast, which is done using an exponential a seasonally adjusted exponential smoothing model for those technically minded. To that baseline forecast, we add adjustments for known factors. And in particular, for this forecast, I've added impacts for the end of the enhanced premium tax credits, which are currently set to go away at the end of this year. Assuming that they're not renewed. And so the current status, and we try to forecast under the current policy, whatever the current rules, regulations, laws are, that's what we try to forecast. So currently they're scheduled to expire at the end of this year. The other factor that we account for is the OHP bridge, which provides OHP coverage to a portion of the same population that is eligible for the marketplace. That is those people between 133% and 200% of FPL. So there's other things going on, obviously lots of other things going on, which are not included as impacts in this forecast, but are known risks. Obviously, they're proposed and it's no longer proposed. I guess it was promulgated, or I'm not sure of the correct word, but the Marketplace Program and Integrity and Affordability Rule has a number of impacts. It looks like that is going to take place. And then obviously the federal budget reconciliation package, that's the bill that is currently working its way through the Senate, obviously could have an impact, but is not included in this forecast. Next slide. Then here I have a laundry list of other potential risks, and for various, a lot of these are difficult to estimate the impact. Some of them are uncertain whether they'll happen. So for a variety of reasons, they're not included, but obviously known risks. So the end of the automatic re-enrollment, so people having to re-enroll every year, is obviously going to reduce the number of people signing up for the marketplace. That's That would be expected provisional eligibility for those advanced premiums. So even if they extend the expanded, and here it says advanced, but it should really be expanded premium tax credits, the provisional eligibility might go away. Obviously, the federal bill may have impacts on Medicaid, work requirements and such, and that may have knock-on effects to changes to Medicaid, obviously, can have impacts on the marketplace. They've shortened the open enrollment period. So now, as currently under the current rule that just passed last week, or not passed, but was instigated last week, the open enrollment period is now November 1 to December 15th. So shorter open enrollment period, we know that that reduces the number of people that sign up. There's a lot of just a lot of uncertainty also in the Oregon marketplace, not uncertainty, but changes to the bridge plan and such. There could be movement in the marketplace here, but there could also be other federal administrative choices seen and unforeseen. And then as an economist, I always add an option, an evergreen risk is that there could be a recession. I don't think anybody would be particularly surprised if we suffered a recession sometime in the next 2 years. We had a negative quarter for the first quarter of this year, so that's always a risk. And that one is maybe a little less clear cut. Recession can sometimes move people out of the marketplace and down into Medicaid, or it can move working people can lose their job that has health insurance, end up on another job that doesn't. And so it can move people both onto and off of the marketplace plans. So all of these are risks that are difficult to quantify. So these are risks that have not been included in the forecast. Okay. So given that, what does the forecast look like? Next slide, please. Oh, sorry, I got more discussion. And not to belabor the point, but the end of the enhanced premium tax credits goes into effect in January 1, and our initial analysis estimates a decrease of a little under 4,000 in enrollment. So we made an adjustment to the baseline, decreased it a little under 4,000 starting January 1. Next slide. The OHP bridge plan, as I mentioned, covers 138 to 200% FPL. People have already started moving onto the bridge plan. Those that are in the marketplace in this FPL range so they're on the marketplace, but they are eligible for the OHP bridge. Some of those people have already started moving over, we assume, but we estimate a total of 11,000 people moving over during 2025, and then an additional 7,500 in 2026. We're assuming that people, by just automatically re-enrolling, that they can stay on the marketplace, and that there's no system change or regulation change that would force them to re-enroll and go through the process, because then they would be moved over to the bridge plan. So we see people in this bracket, in this income bracket, that are currently on the marketplace, and based on those numbers and some estimate of the rate at which they will move over time, we come up with these adjustments to the baseline forecast. And we just assume it's linear. That's a risk. It could be that a bunch of them move all at once if there is some system change or something that forces people to move from one to the other. But we have currently, in the forecast that I'm about to show you, we assume a linear change where over time the 11,000 move out over the course of 2025, and some of those have already moved, and then an additional 7,500 move over during 2026. Okay, so now we get to see the graphs. Okay, so this is the Dates are along the bottom. So we got history. I just showed the history back to January 2021, and technically goes out to January 2028. But the area of interest is calendar year 2026. That's highlighted in green. The number of people enrolled is on the left on the y-axis there, roughly 130,000 currently. The blue line represents the actual medical enrollment. And you'll see we have data. This includes data out through the end of May. So we use the most recent data that was available. Sometimes in previous years, when we've done these forecasts, we've done them in January and, well, in February, and used data from January. And there's that data during the open enrollment period is subject to quite a bit of revision, or it's incomplete oftentimes. And so we need to make adjustments about that incomplete data and try to estimate what the complete data would look like. The advantage of doing this forecast later in the year, sort of more closer to mid-year, is that open enrollment data is finalized and there's a lot less incomplete data. There's very little incomplete data for May. So that gives us a stronger forecast, a more certain forecast. As you can see here, there tends to be a spike during the open enrollments, and then it sort of drops off over the course of the year. And so if we know really what the starting point is, we do a better job of estimating it. Now, the baseline forecast is not shown, but it would have been relatively level across with that same seasonal pattern. But after adding in the impacts of no expanded premium tax credits and the OHP bridge, those decreases over time lead to that dashed green line showing the forecast going down over time. And during calendar year 2026, the average, we estimate that the average enrollment will be 114,061, just a little over 114,000. So that's the number we're working with. That's an important estimate in determining the appropriate rates or assessment in this case. All right. If you do have questions, feel free to jump in. Moving on, the average medical premiums increase every year. That's these stair steps you see. These are the actual average based on the people that have signed up and the premiums they're paying. So it's an average of all the plans and all of the people that are enrolled. It doesn't directly impact the assessment. The actual premium amount doesn't directly affect the assessment, but it is important to determine sort of the percentage, determine what portion of the premium is the assessment. And in this case, it's been about 0.8%, and it's forecast to go up to 0.9 with this increase. But that's why we track and forecast the medical premiums, is to keep track of how much the assessment is as a percentage of the premium. We mentioned previously that there's standalone dental. On the next slide. There's a standalone dental plan. It's quite a bit smaller number of people sign up for that, roughly a little under 30,000, peaks at a little over 30,000. It shows a much more of a sawtooth pattern. So these spikes you're seeing are the open enrollment period, and then it drops off over the course of the year from 30,000 down to 25,000 and then up again. We accounted for the no expanded premium tax credits and the OHP bridge by making the same relative decreases that we made in the medical plan enrollment. So not the same total decreases, but the same relative to the enrollment. So it's the same percentage decreases that we had forecasted in the medical plan enrollment. We made those to the standalone dental. So standalone dental also shows a downward trend. And when we look at calendar year 2026, we're looking at an average enrollment over the course of the year of about 25,680. So that's the forecasted standalone dental enrollment. And then there's dental premiums as well. They have not increased at the same rate as the medical premiums, but they do show a definite upward trend, and we expect that to continue, roughly in the $38 range for those. And I apologize for not saying earlier, these are monthly premiums. So that's the dental premiums. Okay, so the revenue required from the medical assessments. So we showed you the total expenditures for calendar year 2026. It was a little over 10 million. Given the dental enrollment forecast and the dental assessment rate of 45 cents per member per month, that raises almost $140,000 for calendar year. The dental is obviously a relatively small portion of this total revenue that is raised. There's also investment income given the fund balance, and we have chosen assessment rate to keep the fund balance level, and we use the lowest sort of recent quarterly return that they have gotten on this. It's in the 4.5% range. That's the lowest that they've received recently as a yearly return on this fund balance. Okay. So given that, the revenue and these other sources of income, the required revenue from the medical assessments ends up being 9.4 million. So that's the point that we are trying to reach in order to keep the fund balance constant. So given that, on the next slide, we'll see the sensitivity, or we'll see the assessment rate that's necessary and the sensitivity. Next slide.
There's a hand raised. I don't know if you'd like to take that now or if you'd like to hold that, but
no, sorry, I heard the beep, but then I didn't see the hand. Sorry, go ahead.
I am Sakina, and thank you so much for doing the second meeting because I was gone for the first one. I just have a questions, Caleb. The total expenditure of over 10 millions, I'll call it roughly 10 millions. This is based on the key things on no EPIC, what is the word? The enhanced premium tax credit and OHP. Do you have another, calculation on your back of your notebook that if somehow the enhanced premium tax credit were to be renewed, is the expenditure would be smaller and the assessment would be lower in number? Thank you.
Thank you very much for the question. The expenditures are not related to the premium tax credit. Getting rid of the expanded premium tax credit would change the forecast of enrollment by roughly 4,000, but it wouldn't change the marketplace's expenditures, the necessary expenditures. Those are the administrative costs for running the marketplace that the state incurs. And so certainly members, their costs, the members who are buying a marketplace plan, their costs go up. So the individual members' costs would go up, but that doesn't impact the total expenditures for running the marketplace. So it would have an impact, but it would be on the enrollment side, and it would increase the forecasted enrollment roughly 4,000. And so there'd be additional revenue from those 4,000 plans. Actually, if we go to the next slide, I don't have that exact number, but I have something that will let you estimate it. So let's go to the next. So here, I'm just going to explain this table first, and then I'll kind of get to your specific question. So this table, the columns are in the middle there are different assessment rates. The current assessment rate is $5.50, which is all the way over on the far side. That's $5.50 per member per month. The middle column, $6.85, is the amount that we are recommending. The rows correspond to different forecasts, and the current estimated forecast is the middle row where it says 114,061. And then in the middle is how much revenue would be raised given those assumptions, the assumed assessment rate and the assumed forecast. And so for this analysis, we are assuming an assessment rate of $6.85 and a forecast of 114,000. That's the middle row in the middle column where it says 9.4 million. For other forecasts, either above or below that, you would get different revenue. So if the forecast was 5,000 people higher, we would get 9.8 million. So getting rid or assuming that the expanded premium tax credit does not go away is going to be somewhere between, it's going to be closer to 9.8 million. So it would raise additional revenue. And just to finish off this table, over on the far right is the equilibrium rates. That is the amount the assessment would need to be at each of these forecast levels to break even, so that the revenue match the expenses. So at the current forecast of 114,000, the equilibrium rate is $6.85. So that's why we've selected that assessment rate. Does that make sense? And then
Yes, thank you.
Yes. And it looks like there's an additional question from Kathleen, maybe?
Yes, hello. I'm Kathleen Orrick, and I'm just curious on the increases in the rates. And given, the profit margins that insurance companies experience and the struggles that our everyday citizens are experiencing currently with economic situations, and the people that qualify for this specific plan, has it been explored that the possibility of the insurance companies bearing the increase in this rate for both dental and medical?
I mean, fundamentally, the insurance companies pay the assessment to the state and then they choose their rates. And so they can choose to adjust their rates to account for this assessment or not. Did you want to speak to that more, Chicky?
I'd be happy to. And if Katie Button is also on the line, she's our plan management expert. So every year, right, insurance carriers file their rates with the Division of Financial Regulation, and they include the marketplace assessment rate as part of their administrative costs. How they handle their administrative costs is really, we don't have any authority/regulatory guidance about that. I can't speak for DFR in terms of how they are supposed to do that, but I believe the carriers it's their business and how they charge their administrative costs. I don't have any specific guidelines. I just know that the marketplace does not have authority to do so. I will look to Katie Button. Hopefully she's still on the line. I know she's on her way to a meeting. And if other representatives from our carrier companies also have some insight into that, please do feel free to speak up.
Hi, all. This is Katie. Chicky, can you let me know if you can hear me?
I can hear you.
Perfect. One other thing I wanted to note, Kathleen, is that the assessment, while we assess it per enrollee in the marketplace, the assessment is spread across the whole individual market. So the amount is actually a little bit lower than what the assessment is. And then as Chicky and Kayla both said, the carriers can decide whether or not they can absorb that increase within their current rates or they can increase their rates. I will also note that carriers are required to pay out a minimum of 80% of their premiums and claims. And I think our carriers are all up over 90%, which means that 90% of their premiums are going to claims and then 10% are going to administrative costs. So in general, in Oregon, our carriers do have lower administrative costs than they're actually allowed to have. And so it's just kind of dependent on each company whether they feel like they can absorb that without increasing their premiums. But if they do need to increase their premiums to accommodate that rate, then they are allowed to.
Thank you for the explanation. I appreciate it. You know, anything that I can do to advocate that we keep our membership as high as possible or enrollees as high as possible so that, you know, we have a healthy Oregon is just the viewpoint that I'm coming from. But thank you very much.
Thank you for the question. So, as I mentioned, the overall expenditures have gone up slightly or moderately, and the forecasted enrollment has gone down for these various factors. So that is what is driving this recommendation to increase the assessment rate up to 685. So we've kind of gotten to where I started this presentation, where we were going. Now there's a couple of nuances, and I want to show you sort of all of the data, not all of the data, but I'll show you a summary table of all of these pieces so you can see them. But one nuance is that there's regulations that require that the assessments, the total assessments, not exceed 5%. So we can go on to the next slide. Victor mentioned that there was a federal exchange technology charge that's separate from this assessment that we're recommending. That federal exchange charge was adjusted down last year to 1.2% for calendar year 25. And then it's going to go back up if nothing changes. I mean, it was changed to go back up to 2% in calendar year 2026 if the expanded premium tax credits are not extended, or 1.8% if they are. So the current assessment of $5.50 is roughly 0.8% of the average premium. But those premiums are also going up each year, so it's kind of a moving target. But at $6.85, the state assessment represents about 0.94, a little less than 1% of the average premium proposed for 26. And like I said, the combined federal assessment and the state assessment together can exceed more than 5%. So we're not close to that. We're slightly less than 3%. But it's important to note that the total assessment. Given that, then the next slide would be a summary. And I apologize if this is difficult to read, if you're reading this on your phone or a small laptop screen. But this is just to give you the data. If you want to look at it later, it shows the average so it's broken into the medical plans. Data is up on the top third. The dental plan is in the middle third. And then if you add this medical and dental together, that's the bottom section. And we have columns representing each year, and the year in question that we're talking about is 2026 is the far right with the dashed lines highlighting it. And then it just shows some of these sort of key points, the data for these key points, like the average enrollment by year and the total premiums and how much those are changing over time and what the assessment rate has been. And did I hear another question? Yes.
Yeah, sorry, my number is, so you said at the beginning of the slides that you expect about 4,000 reduction in enrollment. But looking at the number on the average enrollment between 2025 and 2026 is about 12,078 lower between 26. So my question is where the 4,000 come from?
Yeah, there was two impacts. There was the end of the enhanced premium tax credit, and there was also the OHP bridge. And so those two factors together, and the OHP bridge was about 11,000, but it's takes place over the course of the year, so it doesn't it's you can't say exactly 11,000, but you have to add those two together um, to get that difference.
Thank you.
hmm Um, so I won't belabor these numbers, but you're welcome to look at them. If you have any questions, you let me know. Um, the total impact that what I was just talking about is the total percentage of average premiums for the combined medical and dental premiums down there at the bottom is about 2.9%. So that's the bottom right hand. And um, you know, the assessment, the state assessment is 1% of that roughly. Okay, so that's the sort of the summary, and then the final piece of information is the fund balance. And I told you that the assessment was set so as to be sort of revenue neutral, so that the revenue, or I'm sorry, the revenue exact match the expenditures. So the fund balance has increased over the last few years, and we forecast it to be, and I'm sorry, these calendar years. So the fund balance is at the end of the calendar year. So that first number, 8.2 million for calendar year 2022 was the fund balance on December 31st of 2022. So in order to keep the fund balance basically level during calendar year 2026, we set that assessment at 685. And so there is projected to be a constant fund balance. Now that if our forecasted enrollment ends up being significantly lower for any one of a number of reasons, then there is at least some cushion to help cover those costs. And so that's just helps mitigate some of the risk. So thank you. If you have any additional questions, otherwise I'll hand it back to Chicky. Or I'm sorry, Lindsay.
I'm just taking a look here at the scroll bar. I don't see any other hands up. Okay. I think we're good to move forward. Did we mean to skip over the prior public comment slide? Just checking. There we go. I think we probably need to check here, and I'm sorry, I don't see any hands up, but just wanting to confirm. And is anyone, Dawn, perhaps is anyone registered for public comment?
No, nobody
Okay.
is.
Thank you. Okay, let's go ahead and proceed to the next slide. Thank you. Victor, anything you want to tell us about next steps?
Just that the next steps will be the ordinary rulemaking process. Because we are increasing the rate, there are some additional steps thrown in that will sort of take place separately, but the rule part is still the same. So we'll be filing a notice of a rule hearing to be held in July, and that notice will go out by Monday, and that will set the stage for that. At the public hearing, people could then present testimony if they have any additional comments, and then barring any objections that we need to address or anything like that, final rule would be in August, with the other pieces being authority from DAS to increase the rates, and also presenting to the legislature that we're increasing and providing justification for that. All those pieces together will equal a yes for plan year 2026 and these rates. And then that kind of, again, any additional thoughts or comments people have can also be provided at the rule hearing. And when we send out that notice, we'll be forwarding that to the committee as well. That was pretty quick, but we're pressed for time. So are there any questions just about process or next steps?
Looking at the chat and the comment or the participant bar. I'm not seeing any. And you said you'd send the notice when it's filed to the committee.
That's right. We usually send out a gov
Great.
delivery and we can forward that.
Okay, so one more option for folks if anyone would like to, of course, participate in that process. Okay, I'm not seeing anything further, so I think we can proceed to voting. We had the prior meeting on the 20th that there was not a final disposition of that vote. And so I think we're going to carry that over, but make sure that folks know how others who are not present have voted. So the motion, Ron Gallinat made the motion to approve the proposed rate, and the second, I believe, was Paul Harmon. So I think we're going to carry that forward, but we need to redo the roll call. So if someone's not here, I think, Chicky, you're going to articulate what their vote was if they were in the prior session. And anyone who was in both needs to vote again today. Anything else, Chicky, you want to say about roll call?
Nope, that was perfect. Thank you, Lindsay.
Okay, please take it away. Thank you.
Okay. We are going in reverse alphabetical order. Joanne, thank you so much for letting us know your current schedule limitations. So, Joanne, how do you vote, please?
I vote to approve.
Thank you. Neshoba?
Vote to approve.
Om?
Approve.
HPA Director Claire Pierce-Robel is not able to join today, but she voted yes on the June 20th meeting. Kathleen?
Approve.
Thank you very much. Shannon?
Vote to approve.
Lindsay?
Yes.
Paul was the second motion. Ron was the first motion. Charlie?
Yes.
Thank you. Stacy? I don't believe Stacy was able to join today, and she voted yes at the June 20th meeting. And then Gladys, in case you were able to join. Okay, Gladys voted yes also in the June 20th meeting. Thank you, HIMAC committee members. The motion is passed with a unanimous vote.
Thank you, Chicky. I think the next slide is a reminder about our next meeting in July. That's a hybrid option, in person or on Zoom. And I was just pulling that up on my calendar, but that is in the morning. That should be from 9 a.m. to 12, either by Zoom or in the HSB. I think with that, we can wrap it up and just wish everyone a safe and healthy summer and see many of you in July. Anything else, Chicky?
Nope, other than thank you very much again for your time and for accommodating both meetings. We appreciate your engagement. And as Lindsay said, hopefully we'll see you on the 17th of July. But if we don't see you or talk to you before then, happy 4th of July, which is already next weekend. It just dawned on me, it's already next weekend. So hopefully if you have time off, enjoy it, and we'll talk to you all on July 17th. Thank you very much.
Bye, everyone.
Bye.